Last class we are discussing about some of the challenges in the infant feeding, and among the challenges we have seen the first case, and we have seen the latch score and some of the important aspects regarding hunger cues, etc. And we have also seen what is the concept of increase in the breast milk, different drugs or methods to increase the breast milk. The concept explained in the contemporary science and concepts of Ayurveda, how they will going to differ. So that portion we have discussed in the last class. So we'll continue the same case here for some extent today. Now the question comes how to increase the breast milk, and some of the portions we have covered in the last class. Now as we know, if I say that this particular drug will going to increase the breast milk, or if I say this particular procedure will going to increase the breast milk, then some things are very common. What is that? There should be increase in the prolactin secretion, whatever may be. Okay, it may be through the psychological method, by keeping the mother in a relaxed mood, or by increasing the confidence of the mother, giving motivation to the mother, or giving some of the drugs. Whatever method you adopt, ultimately for the increase in the breast milk, there should be increase in the prolactin level. That's quite sure. Okay, now the question comes how to increase the prolactin level, or how to increase the prolactin reflex. Okay, so prolactin reflex or prolactin level has to be increased. That's the only way out. Okay, so we are using different procedures, different methods, different maneuvers to increase the prolactin in the blood. Okay, so once the prolactin is increased, naturally the breast milk production will increase. So now prolactin is produced after a feed to produce the next feed. That means usually when you emptify one particular breast, then that itself is a stimulation again for the production of the prolactin. Okay, once you emptify the breast, then again the prolactin secretion will go into high, and again prolactin will go into work on the breast parenchyma, and as a result there is production of more and more milk, and that will be stored in the lactiferous duct. So what is very important for the production of the prolactin? One is continuous breastfeeding. Okay, continuous breastfeeding is important. Okay, now if the feeding is not given, or if the feeding is delayed, then there will be less production of the prolactin and less feed will be coming. That's natural. Therefore always we say that whatever may be the consequence, you keep on giving the breast milk to the child, or although there is no breast milk secretion, let the baby suck. Okay, that itself is the main stimulation. When the baby, that means whatever the amount of breast milk which is produced, that has to be emptified. When that will be emptified, there will be production of more and more prolactin. Again there will be production of more and more breast milk. That's the key factor. Okay, especially now there is one more important aspect is about the night feed. We have to encourage the mother to give the night feed. That means one late night feed and one early morning feed. That is always important. It should not be mixed. Why? Because the night feed should be given so that enough prolactin can be produced, because the secretion of prolactin is always more in the night. So that means if the mother is emptying her breast during the night hours, then the production of the prolactin is more compared to the daytime. So therefore, because all these pituitary hormones, they usually produce in the night hours. Okay, early morning, night hours, like that. So they maintain a rhythm. So now it's quite clear that even the prolactin secretion is also more at night time. So to have more and more prolactin secretion, you have to emptify the breast in the night hours. Okay, so therefore nighttime feeding the baby is also very, very important factor in increasing the breast milk. Now to understand the physiology of this lactogenesis, production of this breast milk by different method, that's called as lactogenesis. Now we have to understand this. Understand the physiology of the lactogenesis. Lactogenesis, actually there are three types of lactogenesis. Number one is lactogenesis 1, lactogenesis 2 and lactogenesis 3. So what do you mean by lactogenesis 1? Lactogenesis 1 means it is happening in the antenatal period. Okay, so it starts as early as 6 to 40 weeks of pregnancy. When the mother is of 16 to 20 weeks of pregnancy, pregnant lady, that time itself the preparation for the production of the breast milk starts. There will be increase in the size of the breast, there will be hypertrophy of the breast parenchyma. So like that, the changes will going to start. So actually lactogenesis 1 means this prepares the mammary glands for the future production of the breast milk, and there is also initiation of the synthesis and increasing the capacity to produce the milk in future. That means they prepare the breast parenchyma properly. Lactiferous ducts will be formed, they will undergo proliferation, so many number of lactiferous ducts will be formed. So like that, when the prolactin level increases, then there will be production of the more and more breast milk, and the preparation for that was beginning in the antenatal period itself. So this is called as lactogenesis 1. So when I talk about lactogenesis 2, this actually happens immediately after the birth, in the postpartum period. Okay, this is called as lactogenesis 2. Okay, now immediately after birth, about 30 to 40 hours, that is very crucial actually, and it is very difficult to handle. That is what actually Ayurveda says, that immediately after birth, in case of primaries, so tritiya dvha panchama dvha siranam vivrutatvat. Okay, so there will be some problem in the production of the breast milk initially because of the siranam vivrutatvanam. That means the channels, okay, the breast milk producing channels are get closed, and as a result a mother may face some difficulty in the production of the breast milk in the first 3 or 5 days. This is what Ayurveda says. A similar thing is also explained in the contemporary science, where they say it is very difficult to handle about the 30 to 40 hours immediately after birth regarding the breastfeeding. Okay, because sometime it may be delayed, the breast milk production may be delayed, or it may be further delayed sometime if there is any lack of confidence, or if the mother is undergone the LSS delivery, and then certain other hormonal problems or nutritional problem, etc., if it is there. So this production of the breast milk immediately after birth, that is lactogenesis 2, may be delayed. So therefore they do agree that the first 30 to 40 hours immediately after birth is really challenging, and mother has to be handled very well. We need to give the motivation, confidence, and all those things. Okay, in this phase, usually in this phase, that means lactogenesis 2, first 3-4 days of birth, so only about 10 to 40 ml of the colostrum may be coming. So usually in the first 2 to 3 days, or rather 30 to 40 hours, there is no much copious amount of production of the breast milk. A small amount of the breast milk is coming, and that is also something watery, and that's called as colostrum. Previously, the uneducated people, they used to discard this colostrum, thinking that this is not a pure breast milk. Pure breast milk comes thereafter, later. So, but now we know that, everybody knows that colostrum is very important. It's rich in immunoglobulins or immunological factors, etc. Now, this is followed by the copious milk production. So actually lactogenesis 2, this particular stage is very difficult to handle. One is the importance of the colostrum has to be understood, and then first 3 days, there should be a balance between the neurological system, balance between the hormonal system, balance between the psychological system, and balance between the hormonal system. So that has to be get established. What do we say? Hypothalamic, pituitary, mammary axis. So that has to be well developed. Okay, so then only the proper production of the breast milk will be there. But this stage has to be handled with the patients and by confidence. So this is called as lactogenesis 2. The same has been explained in Ayurveda, that there will be some problem in the production of the breast milk in the first 3 to 5 days. The last part is lactogenesis 3. Lactogenesis 3 means it is the later part. Once the colostrum is produced and the initial hurdles were over, and then there will be production of more and more copious breast milk production, because there is more production of the prolactin, and baby is also sucking the breast milk properly, feeding, and it is emphysifed properly. Baby's demand also increases. So everything will now work up, and as a result, there is copious amount of milk production will be there, and mother and baby both are enjoying. So this is how the lactogenesis takes, 3 stages of lactogenesis. What is important is prolactin is important. Prolactin has to be produced. Okay, so when I talk about Shatavari or Lashuna, etc. drugs, which will going to increase the breast milk production, probably so many research work has been done on Shatavari also, that it is able to produce induce the production of a prolactin. So prolactin has to be produced. Okay. Then Chinta, Shoka, Bhaya, Krodha, this should not be there for the mother, because these are one which will go into affect the hypothalamus. Okay, because when the hypothalamus is cool, then only the proper production of the breast milk will be there, because we know that all the hormones are produced actually from the hypothalamus, later it is stored in the pituitary gland. So a relaxed state of mind is very important. So Chinta, Krodha, etc. So definitely hampers the production of the breast milk. Then structural problems related to the breast milk, we have seen in the last class, inverted dimples and all this, that has to be corrected. Preferably it has to be checked in the antenatal period itself. Anyway, so this is about the case number 1. Now look into this particular case number 2.